question. How would you recommend I deal with anxiety, guilt, and doubt over a memory, right? And no doubt you two have worked with this, so I think this is a neat discussion.
The really challenging part of OCD, and the fact is that you accepting the fact that you might or might not have done this. I don't know if you are getting ERP therapy, but the thing is, the thing about OCD is you will never be able to convince yourself that you may or may that you did not or did do this part of your memory. And I think that through the exposure and response prevention, especially the response prevention part, because that is really the crux of the treatment, is that when you're, exposing yourself to what you think you might have done and then preventing yourself from those responding in those safety seeking ways, right? To prevent yourself from whatever, trying to block yourself from what you are trying to not remember. I don't know what that memory is, but ERP will teach you to circumvent or to avoid those safety-seeking behaviors, because all they do is maintain the OCD. You might feel better for some time thinking, okay, you didn't think about what you think you might or might not have done. But what ERP will teach you is that eventually, when whatever you're trying to avoid, you will find that either it is not as scary as you thought it is, or if you do end up exposed to that fear, that you are stronger through ERP therapy and you can face it, and you have the tools and the resilience to overcome whatever it is. And you are you're able to handle it much better than you thought you were able to. And that's why we really encourage people to do ERP, because while it feels brutal and it feels sometimes like, why are you doing this to me at first, you develop so many skills and so many other things to do that. So it's not to convince you as to whether you did or didn't do it, but to teach you those skills to to give you that resilience, and to teach you to break that loop, basically.
I've always been fascinated that OCD doesn't care what you forgot in 99.9% of your life. But in this one instance, you cannot forget this thing. This has to be remembered, and remembered perfectly. I mean, I have forgotten more in my life than I currently know. I guarantee you that. And yet OCD is okay with all of that, again, except for this one thing, right? This is the thing that you have to be perfect at. And if you're not perfect at this, that ruins everything else, right? This is actually the pinnacle and the most important thing. So it's about being able to sit with doubt, as you both have said, and allowing that doubt to be there, and to become cognizant of the fact that I will never get the 100% satisfaction that I know something for sure that OCD demands of me, because OCD is an insatiable disorder that has never given anyone 100% guarantee for anything that they've had OCD about. Never once has a patient walked into my office and said, Dr. McGrath, I have finally satisfied my OCD, and now it's gone because I finally gave it everything that it wanted, and it said thank you, and then it left me. That has never once happened. That is never going to happen. It doesn't work that way.
Yeah, and I think really understanding, Dr. McGrath, you bring up a good point that every day of your life, you don't know something. Every day of your life. AV is saying it's really hard in the moment. It's really difficult in the moment to accept uncertainty. And I dig it. I absolutely do. But think about it this way. If you look at the forecast and there's a 40% chance of rain, then there's a 60% chance that it won't rain, right? You just don't know. I'm going to grab an umbrella, right? I'm going to grab the tool that was given to me, created for this exact circumstance. Response prevention is your umbrella. It's your umbrella. Pick it up on a 40% day. I mean, and expect that your days are about 50-50 most of the time when it comes to rain, when it comes to OCD symptoms, when it comes to, because it's unfortunately chronic. And as Dr. McGrath said, it's kind of always going to be a doubt thing. I would say look at response prevention, the things you learn in ERP. And if you haven't learned it, I highly encourage getting what a therapist and learning it.
Mhm.
Absolutely.